evening everyone. Kumusta na kayong lahat? Pilipinas man o ibang bansa. Mega love shoutout sa inyong lahat. Sana nasa mabuti lang kayong kalagayan. Saan man sulok kayo na mundo naroroon. Sana'y okay lang kayo. Okay? For tonight, video, I'm going to share about a stroke patient on how we look after them, on how we do the care. Mapa home-based man or mapa AIDS care facility, rest home, hospital rest home, or whatever. So, I'm going to share you, this is just based on my own experience. When you are dressing the patient with stroke, kung ang weak side niya ay nasa kanan, kung bibihisan nyo siya, mag-uumpisa kayo doon sa weak side niya, doon sa stroke arm niya. Doon nyo muna bibihisan at huwag nyo nga hatakin. Don't pull it. Just hold it gently, support the arm while pushing it through the sleeve. Dahan-dahanin nyo gently. Ganon. Bago ang good side. But when you are undressing, you have to undress first the good side before the bad side. Para hindi itaas ang arm nila. Para hindi, kasi once you start the bad side when you are undressing them, so you have to lift that arm. Again, they will struggle, they will be in pain. So you need to be very, very careful. And also before anything else, before you start the cares or whatever you are going to do with them, you need to approach them with a positive way, smiley face, is a friendly face, and you need to explain to them what you are going to do, and you have to reassure them that you will do it gently. Because if ever you will just approach them without telling them or letting them know what you're going to do, they will be scared. They will not let you do it. They will be very scared, you know. But you need to make sure, and if they are still verbal, they can still talk. You need to ask if they are in pain before you start the care. Or if the patient is non-verbal, you also look for a sign of pain when you are doing cares. You have to check the facial expression because kagaya ng nasabi ko, they're not able to tell you if they are in pain. All you have to do is just check for the sign of pain. The facial expression, the facial clenching, you can see. So, you can tell if they are in pain. If they are in pain, you have to stop on what you're going to do. Let the nurse know, and then they'll be given a pain relief prior the cares. So, as I said, always explain what you are going to do and be positive and be friendly. And reassuring is very important so that they will allow you, they will trust you. Otherwise, they will not let you do. Because some of them are very grumpy. If they are in pain or whoever, kahit minsan tayo nakaka-experience tayo ng if we are in pain, nagiging grumpy tayo, nawawalan tayo ng pasensya, di ba? Kasi we are in pain. So, if you are working in AIDS care facility or wherever, home base, if you're dealing a patient which is grumpy and very rude, just be patient and just don't take it personally. Because nagagawa siguro nila yon is because they are in pain. Because as I said, when you're working as a caregiver, you need to be very patient. Very patient and very understanding, you know. So, yun ang puhunan nating mga caregiver kasi hindi natin nararamdaman ang nararamdaman nila, you know. If they are in so much pain, of course, they will be grumpy. All you have to do it, don't take it personally. Just let it go, you know. Just take a breath. Breathe in, you know, para mawala yun. Or walk out, walk away. Yun ang mga technique para mag-deal sa mga pasyenteng grumpy. But as I said, don't take it personally because they might be in so much pain. They might have a bad day or whatever. So just be patient. Just be very patient. So, yeah. Or back to our topic about so as I said, back to our topic, with the how we cares about how we do the cares of the stroke patient. When we are transferring them, like, because mostly sa mga stroke patient, full assist, so we will be using the ceiling hoist. Ceiling hoist is the machine that will lift you up, which is safe for them and safe for the caregiver. Lifting it up from bed to chair and chair to bed. Ganon. They cannot stand anymore. They cannot weight bear. So you have to use the ceiling hoist, which is I will probably show you what is the ceiling hoist look like. And also, if some of the stroke patient is still able to stand up, is still able to weight bear, so what we will be using is the standing hoist. But all of this transferring, you will not be doing it without the assessment of the physiotherapy. Once the patient had been assessed on what we will be using lifting aid, like ceiling hoist or whatever standing hoist, it needs to be from the physio. We cannot just decide or make a decision on what lifting machine we will be using for them. If you will use the standing hoist, they might not be able to stand up, or they are not suitable for the standing hoist. You will make it worse. So it needs to be assessed first by the physio. There must be an assessment, and then from the physio, we'll pass it on to the nurse, and the registered nurse will explain to us during our handover on what kind of lifting machine we are going to use for that specific patient which had a stroke, you know. So ganito ang nangyayari sa amin sa facility namin. Sa mga nagkaka-stroke, it needs to be assessed by the from the physiotherapy, and then there will be a therapy for them as well, which you need to be assisting, and you need to encourage them as well, encourage their mobility. Otherwise, if they will not use their mobility, they will lose it, either lose it or don't try to use it, you know. So yeah, back again to our main topic about caring. Transferring, when you are transferring the patient, it's either ceiling hoist or standing standing machine. You need to support the weak arm. But as I said, if they are being assessed by the physiotherapy, I think they will, I'm pretty sure that the physiotherapy will provide a sling to hold, to support. There will be a support for that weak arm. So you have to be very careful when transferring. Make sure you are supporting that arm throughout the transfer. You need to support arm, because they cannot just, just leave it hanging. It will be very painful for them. So same thing as from transferring from chair to bed, like vice versa. And also, sitting in the chair when you transfer, make sure again that you have a pillow to support that arm, because when you have a stroke, you cannot sit straight. You might be leaning in one side or in the weak side. So you need to make sure that is supported also on their back. And when you are settling them in bed, also make sure that if they are lying on one side, don't let them lie on their weak side. It's gonna be very painful for them. You need to let them lie on the good side, and again, need a support on that arm. Always, make sure it is supported. Kasi, lalo na sa kanila, kung di sila nakakagalaw, from the time you had settled them until the night time, they might not be able to be reposition, or sa amin kasi, in our facility, we have the reposition. So, ayun guys, na-share ko na yung mga dapat kong i-share. Ito lang naman is based on my experience, okay? So, yun. Again and again, I'm saying that you need to be friendly when approaching them, because it will help them though. it will, when they are in pain and also scared to be touched on their bad side, on their weak side, on their pain side of their arm, they will not let you do the cares. They will not let you do it. You need to be, you approach it within a positive way, smiling face, your body language, positive way. Always reassure them that you will do it gently and let them explain to them that not to be scared, you will handle them with care, special care. So they will trust you and then they will let you do the cares. Okay? So yun lang mga guys, mga palalabs. At least na-share ko sa inyo kung sino man ang mga nagbabalak magtrabaho sa caregiver and they still have no idea on how to look after as a stroke patient. So at least kung may natutunan man kayo dito sa video ito, please like and subscribe and i-hit nyo na rin ang notification bell para maging updated kayo sa mga susunod kong mga i-upload. Kasi marami rin ang mga nanonood na nakakalimutan nila mag-subscribe. I hope so. Na nakalimutan lang. So please subscribe nyo na rin, as free lang naman po yan. Okay? Thank you guys and thank you so much for watching. Thank you for supporting my YouTube channel and sana patuloy nyo akong suportahan. Thank you so much everyone. And I love you all. Bye-bye. Bye for now. Bye.